Picture this. It's Monday night in the Peds zone, peak of RSV season. You're waiting for the Peds resident to call you back for a 9-month-old you're going to bring in who has cough, fever, mild hypoxia, and doesn't look quite ready to go home. Peds admitting calls back, asks you to get a viral swab. Oh, and don't send the patient until Peds has made it down to see them. You look to your nurse.
Dr. Bambini, I'm available to holding help in C32. Thank you.
You look to your attending. You get the idea. So, segue. This month at Journal Club, we're looking at the utility of viral swabs. The first paper is from 2006 and is a bread and butter trial from Nashville where they randomized which toddlers with URI symptoms got rapid viral swabs and then looked at how it affected the number of additional tests these kids got. Depending on how you interpret it, this trial did find some benefit in the ED and is the basis for why probably some Peds ED docs have been for the swabs. Next is a trial from a couple years later in Canada in a similar population that did not find a decrease in ordered tests or antibiotics prescribed in the ED. They did find a decrease in antibiotics prescribed at follow-up visits. The third paper looks at cohorting, something we do sometimes at our hospital. In other words, placing two pediatric patients with the same respiratory virus in the same room when bed availability is low. The paper adds evidence that we probably over-isolate patients. It also questions whether viral swabbing makes a difference in terms of who should get isolated. Lastly is a randomized trial from Netherlands published just this year that looks at viral swabs in URI kids coming into the hospital. So the idea was that getting the swabs in the ED before the kids go upstairs might reduce the length of stay and other things like antibiotic treatment if the inpatient team gets the results the next morning. They did not find a change in the length of stay in those who had viral swab results made available the next day, and they actually showed an increase in antibiotic use in those with positive viral swab results. By the way, if you're wondering, this curtain is 2-piece. So that's November's Journal Club. The papers should be in your inbox. And if you're still watching this, wow. Thanks to Dr. Barcombe. And thanks to Jen, Misha, Michael, and Emily Miller for helping out with Journal Club this month.